Bismillahirrahmanirrahim and welcome to Tabadlab Live. Today's guest is Dr. Faheem Younus. Dr. Faheem Younus is increasingly one of the most important social media voices in the world today. And I don't say that lightly. Dr. Faheem Younus was not super well known, even though he's the head of infectious diseases at the University of Maryland Hospital, if I'm getting that right. And so clearly he's an expert in things like COVID-19. But his importance on social media has grown by leaps and bounds because over the last 2.5, in fact, 3.5, maybe 4 months, he's been one of the places that many people go to understand what to do and how to react to every breaking news story, every new drug, every new fad, every new government decision. A lot of us tend to rush to our Twitter feeds to see what Dr. Faheem Younus has to say. So we thought, why don't we just go to the mother, just go to the source code and get the mother lode directly from the man himself. Dr. Younus, thank you for making time for us.
Appreciate it. Thank you for having me.
Dr. Younus, this global epidemic, obviously, there's so many different aspects to it, and everybody's talking about it. One of the things that you've been focused on your Twitter timeline has been the infodemic, the global infodemic that has accompanied this pandemic. Based on your experience on the front lines, what is the strategy that you hope that governments would adopt? Clearly, well, not clearly. I guess we want you to answer that. But is it true that governments are doing the best they can, or do you think, from an information and awareness standpoint, they could have done much better? And you feel free to talk about the U.S., Pakistan, or any government that comes to mind.
Sure, absolutely. First of all, I think I empathize with doctors, with governments, and with the crowd, with the public, because none of us went through this before. This is our first rodeo for many of us. But the reality is, it's not that I'm expecting people to know everything in March or February. I'm just expecting people to be humble enough to have some deference to expertise and learn and adapt. And if I still don't learn and adapt as a doctor after 3 months, then something is to be said about me. So the reality is the science of outbreaks is not new. I've managed outbreaks in my life before. WHO has managed so many outbreaks, H1N1, Zika, SARS, MERS, you can name so many. The science of outbreak is that you have to get at the front end of communications. Because most outbreaks, when they start, you don't have a test, you don't have a treatment, you don't know a lot. What you do know is that you don't want to overly give hope people to the point of being dishonest, because the tendency is to just give hope to people at any cost. And over again, we've realized that's a mistake. It comes back to haunt you. You have to be ahead of the curve. You have to tell people what you know, and you have to very clearly articulate what you don't know. And you simply say, look, we'll be back next week. We'll be back in one day, but we simply don't know this. So the opportunities lost in this case, I believe, is lack of deference to expertise. Me as a doctor should not be commenting on lockdowns. Lockdowns are very difficult government strategic decisions. They have to look at a dashboard of different metrics before they make such decisions. And neither you, or I don't know about you, but as a physician, I don't have all those data points. And similarly, respectfully, whether it's an anchor or whether it's a politician, they are not infectious disease experts. It's very dangerous for a non-physician to come out and start talking about how this virus spreads or how dangerous it is, because you're in a very dangerous turf when you say that, because when facts come against you, you have no standing. So I think what we need to do, the opportunity is for all of us to swim in our own lanes. Number one, stay within our own expertise. Number two, be brutally honest. You may know something, say it. You don't know something, tell people we don't know. If something is more harmful than helpful, tell them this is more harmful. And number three, align yourself with authority. I don't want people to listen to me because I'm expert for 25 years. I want to align myself with the World Health Organization, who have the best, smartest, brightest minds and a huge infrastructure at their disposal. So if anything that I say is in contrast with WHO, I think your audience should not listen to me, because I need to be science is science. It's the same 9.8 meters per second gravity in every country of the world, right? We can't say in Pakistan the speed of gravity is different. Yes, in viruses, in bacteria, there can be some variation, but not night and day. So that's an opportunity still with us, because I would say if this is a game of 4 quarters, we're probably just done with the first quarter. I think there's a lot left. So there is still a lot of recovery that we can do in our messaging.
Absolutely. I like the analogy of the 4 quarters. Clearly, you've been watching Michael Jordan's Last Dance.
I'm a football fan.
Oh, are you? Okay. We'll talk about football as well. Hopefully, we'll get to watch both football, as in the real football, which is in the rest of the world, and the NFL, which I love, but which we call American football on this side of
Sure.
on this side of the planet. Dr. Younus, talk to us a little bit about how this happened. I don't know what your Twitter following was at the start of the pandemic, although I can proudly say that I was an early adapter. I probably started following you sometime in January or February. But how did explain the
Sure.
journey of your Twitter celebrity, if you will?
Well, first of all, and with all honesty, that bothers me. That does not make me comfortable, because this is not about me. And you'll understand within 3 or 4 minutes that being famous or popular is not something that resonates me, makes me uncomfortable. I'm very happy in my living room with my family. But what happened is one day I came back from work in the beginning in March, and in my living room with my family, my daughter who's back home from college, and I was just sort of expressing to my family that, look, my days are so long, and all the cousins and family members and my colleagues and my social contacts have been calling me, texting me about COVID. And usually I'm well known to get back to people, but I'm being really bad. I cannot get back to anyone. I'm just swamped. So I'm sharing my pain and suffering with my family, that a lot of aunties and uncles and nephews and nieces are probably hating me right now, that, oh, who do he think he's become some big shot and he's not getting back to us. And as I'm expressing my anguish, my daughter says, Baba, why don't you start tweeting the answers to their questions and just let them know once, so they can get all their answers on Twitter and it'll be efficient for you. And it just clicked with me. I'm like, all right, because I was really feeling the guilt. And I got on Twitter and I just tweeted a thread of 10 myths. And that's exactly what I was hearing on those text messages. Next thing I know, in the next 2 days, those myths were watched by nearly 30 million people. And that allowed me, and then the questions kept on pouring. And I think very quickly I realized the calling, the purpose of this profession is to help people. And me being a gray bearded man like you, didn't understand that I could literally help my own people in the boondocks of villages of Pakistan sitting here in America. And it still gives me goosebumps when I think about that God given opportunity. So I'm just there to try and do my piece for my country, for my people. And hopefully, once we are on the other end of this pandemic, you'll see me fizzle away from Twitter and I'll be back to my living room.
Well, I hope not. I think we need a lot more science and a lot more data and a lot more humility in the public sphere. And I pray that the spirit with which you entered the fray is one that guides you and continues to grow the audience that you have. But I think it's also telling about the moment that we're in, that so many people are turning to Twitter, to a, forgive me for saying this, but to a otherwise unknown doctor who seems to know what he's talking about, has the stamp of authority of professional sort of, gravitas, but really is being clear and concise. And essentially, the quality I like most about your timeline is it's unemotional. It's not lacking passion, but it is not appealing to emotions. I think that globally, I think there's a problem in your adopted country, the country you live in, as well as the country that you're originally from. because I think it's, this infodemic concept. I think a lot of people are swayed by emotion rather than by data and facts. So I would say, please don't withdraw from the public sphere. Help us get past this, because there'll be another problem in the public health sphere tomorrow. In fact, there already are. And even though I had a bunch of questions for you about COVID and how we could get your guidance on how to deal with this, but since we're on that topic, you already know that Pakistan is one of the few polio positive countries on the planet. The New York Times this weekend wrote a story reporting the fear that the WHO and the Bill and Melinda Gates Foundation have with regards to things like rubella and measles and a whole bunch of other infectious diseases. And the reason and the logic behind that fear, of course, is that the COVID-19 crisis has brought a lot of those immunization programs to a halt. Now, these are not problems that the US has to deal with on a day-to-day basis, but a lot of the quotations in that piece were from the CDC arm, the international arm of the CDC, the Center for Disease Control. Are you worried, as much as perhaps I was reading that piece, that the outbreak of other diseases in Africa, in Pakistan, in Bangladesh, in India, in Afghanistan, that those outbreaks are not only possible, but will also wipe out 2 or 3 or 4 decades of progress in some of these cases?
It's very likely. Actually, it's going to happen everywhere. Even in US, people have become COVID phobic. So they're not going to hospitals, they're not going to doctors. And we've already seen childhood immunizations, measles, mumps, rubella, being missed or skipped. So, of course, in countries like developing countries, Pakistan, Nepal, Sri Lanka, India, we're going to see a lot more of that. And what people don't realize that the average life expectancy has gone up from 40 to 50 years to up to 80 years. If you go back and you see exactly what changed, there are two things. Despite all the advancements in heart disease and cancer and surgeries, it's vaccinations and infant mortality. Once you change those two factors, life expectancy changes. So you're absolutely right. I think if this pandemic lasts another year or two or longer, which is quite likely as of today, not only that other infectious diseases will start rearing their own ugly head, we will start seeing cancer being missed. People who are going to get a screening mammogram or a CAT scan in January will end up getting it in June because they will delay care. In Hong Kong already, during the time of SARS and now, they did a study that people who have chest pain and when they call the ambulance, that time has gone up 3 to 4 times. Typically, if you have chest pain, within half an hour, you're calling an ambulance. And now people were calling an ambulance after 2 to 3 hours because they're afraid. So yes, there will be a lot of ripple effect and it will erase a lot of gains. But the reality is, how do we mitigate that now that we know it's likely to happen? I think we have to establish trust within each other. It has become fashionable to just trash CDC or trash WHO, or anybody who has a Twitter following is these days is a COVID expert. And I think that's not right. And we need to understand, if anything, this virus has taught us some very good lesson, Musharraf. One lesson is the virus doesn't ask, you are a Shia or a Sunni or a Pakistani or an Indian or a black or a white or a rich or a poor. The virus only asks one question: are you human? It's such a non-bigoted, such a fair, equal opportunity virus, right?
It's a Sufi virus.
It's a Sufi virus if you really think about it. And it's such a humble virus. It comes says, I only have 1% mortality. You don't even have to be afraid of me.
Yeah.
And that's exactly how it lulled so many world politicians into this slumber for a couple of months, because people didn't understand. That is true. I still believe mortality is 1%. But when you scale it to 100 million people, that's 1 million people in a country. So I think we have some lessons to learn from this virus, that if we establish trust in our institution, then if we rise up beyond our self-interest, then yes, a lot of that can still be mitigated. Unfortunately, I don't see any signs of that happening.
Which is why the kind of expertise that you represent, and I think we need a lot more voices like yours, and I hope they emerge. For every quack, or half-baked conspiracy theorist, or a bad information acting politician, maybe not malign intent, but certainly malign impact. When you say things that you don't mean to say from a malign intent perspective, you just say because you're a politician and you're used to saying things. I mean, that has real consequences, not just for today, but as we were just discussing with respect to the slowdown or the termination or suspension of immunization programs. That's going to have an impact on a lot of lives, it even far beyond the COVID-19 crisis. Doc, we only have a few minutes left today, unfortunately, and this is going to be a quick one given how busy you are. I wanted to ask you about something that I think probably exists in greater measure in traditional societies like India, Bangladesh, Afghanistan, Pakistan, than it does probably in Western Europe or North America, and that is the reliance on traditional medicine. In India, it's Ayurvedic medicine. In Pakistan, homeopathy is a big one. Jari bootiyan, Unani medicine. There's a lot of terminology, acupuncture, different herbs, herbal medicines. All of these things take up quite a lot of space in the discourse around COVID 19. I can suspect what I think you'll say, but I wanted to hear the science on this first, and then I wanted to maybe ask you a few follow up questions.
Absolutely. So I think there are three buckets. There is a known good, then there is a known bad, and then there is an unknown in the middle. So the way I approach it, there is known good. COVID-19, for example, the PCR test. If you say that there is any other way to test it with herbs and traditional medication, I'll respectfully disagree because there's a clear known. And then there are some clear knowns that are harms. For example, if you say Sana Makki people should take it, well, we know there's a clear harm. It's a laxative. It's going to cause diarrhea. You're going to lose electrolytes. You may fall and break your hip, or a whole host of other problems. So I'm very clear about those two things. And I think that's where I should respectfully present my view. Then there is a middle unknown. Does honey have an impact? Does kalwanji have an impact? Is homeopathy going to be good? That's where I don't see any evidence of harm yet. So I think it'll be very arrogant on my end if I said, don't do that, because that's where it requires humility. It requires the acceptance that no one has all the knowledge, whether they're Ayurvedics or homeopaths or doctors. We are all focused on the same. Again, we need to be united against this virus. So I'm very, very flexible when it comes to that middle path. I think that's where more research needs to happen. And yes, that's where we are very adaptable, and we should not be legislating or beating people down with a stick. But if someone starts proposing a substance that's harm, for example, hydroxychloroquine, it's an allopathic medicine, but I would put it in that category where now there's more and more evidence that there's more harm. I'm worried about the dexamethasone study that just came out, because that's the mother of all drugs in terms of side effects. A very potent steroid that's going to have a side effect in almost every body system. So I will be very strongly against people misusing those substances, whether they're allopathic, homeopathic, Ayurvedic. But in the middle category where we don't know, I think we all need to come together. We need to stay humble, and we say, all right, let's continue to think about it.
I think no better note to end this conversation on than the idea that if you know everything, how are you going to learn anything? So the first step in making anything better, including COVID-19, is to accept that there's a lot that we don't know and to tread humbly. And on that journey, Dr. Younus, I feel privileged to have you as one of the Sherpas. I'm sure every one of your followers and that whole gang of aunties, uncles, and cousins also feel quite privileged. So we're lucky to be part of the extended family through this medium called Twitter.
Absolutely. And I would say it on the record. I feel like I've known you for years, even though this is our first meeting.
Well, I hope it's the first of many, many more to come. Thanks so much for making time for us, joining us today, and we look forward to reconnecting real soon.